When the weather gets warmer, vein disease symptoms like leg swelling and the appearance of varicose veins can get worse, impacting everyday activities like walking. Brad talked with USA Vein Clinic's founder and CEO, Dr. Katsnelson, about why vein screenings are so important.
Good morning, doctor. How are you doing?
Very good. Thank you for inviting me.
Well, this is such a very important topic. So let's talk about what vein disease is and how common it is in the U.S.
There are two parts of circulation. Arterial part of the circulation brings fresh blood, and venous part takes the used blood like a sewer for cleaning. So venous diseases are very common. About 30-40% of adult population suffer from this disease because, people stand a lot, and the veins, they're very, very thin wall. They get stretched, there are valves inside, they fail, and people start having a problem. Very, very common problem.
Yeah. All right. So who's at risk for this and why?
So, number one thing, okay, at least you have someone to blame, hereditary. If you have one parent, 75%. If two parents, 95% that you might have a problem. Also, people that's standing a lot, that people overweight, women with multiple pregnancies, people that stand a lot during the work, teachers, nurses, people that work in a different manufacturing jobs. It's a very, very common condition.
So, wow, this is important for people to learn this. So let's talk about what are some of the signs that people need to start looking for this type of disease.
So there's two kind of groups of signs and symptoms. One is because of the congestion, things like a flooded basement, right? Because circulation doesn't work very well, and there's a lot of pressure, swelling, bulging veins, discoloration, some big, heavy legs. And second thing is just feeling of pain because it's an old blood, it's not fresh, it intoxicating the tissues, so pain, burning, itching. Sometimes it's so bad, skin just falls apart, creating wounds.
Wow, well, this is such interesting here because you don't really hear about that much, but we do hear about DVT. Explain what DVT is and how this is starting to become a problem for a lot of people.
It's good. I think everyone needs to know that vein disease is the 10th leading cause of death in the United States, similar to diabetes. And even asymptomatic venous insufficiency that on ultrasound we see the valves are failing leads to DVT, deep venous thrombosis. When you have a slow circulation like pond versus river, because of the slow circulation, things can get sludgy and it gets the clot, DVT. And those clots in the legs, those thrombosis, can fly towards the heart and create what's called pulmonary embolism. So people, asymptomatic even, venous disease can leave 5.3 times increased risk of DVT. And 25% of DVT diagnosed post-mortem, too late. And if we diagnose it, patient is alive, 30% risk to die within 6 months, 37 within a year, worse than most cancers. So that's why it's so important to not to get to this point and fix one early. When people feel the swelling, pain, bulging varicose veins, they think, oh, maybe it's something cosmetic. Spider veins, don't worry about that. The symptoms and bulging vein and swelling, they need to go to the doctors, do ultrasound. In ultrasound, if we have truly problematic veins, and they can be treated with very small procedures, takes 10, 15 minutes, 5 minutes, local anesthesia or no anesthesia. That's how minimal and no discomfort the treatments, covered by insurance, you can kind of save your life.
Yeah,
Definitely improve quality, but very much so can save your life as well. So it's not something to take easy or lightly. It's something to fix circulation. No circulation, no function, life is worse with a bad circulation.
Yeah, this is such a very important topic and very important for people to get checked out. So I know you have 3 locations here in the Arizona area. Where can people find more information just in general about what you guys can do to help them?
So we have 3 locations in Glendale and Phoenix. And you can go to usaclinics.com, usaclinics.com, and you can even schedule online. And there's a lot of information about treatment, about symptoms, about insurance coverage, and we have fantastic physicians. We have overall 170 clinics in 33 states. We've been around for 21 years. I'm a Harvard-trained heart surgeon, so we really have phenomenal expertise, the best in the world, and would love to help people in Arizona.
So, Doctor, thank you very much for joining us. Thank you for the information. And of course, we have information on the different websites on our website, cw7az.com also. So thank you, Doctor.
Thank you for great questions. Have a great day. Thank you.